has to do with the deputy president. This has been a trend, and Mike will have the unenviable task of moderating over that discussion. But I will skip over to the other bigger stories, Corona and what have you. And just to introduce my panel this morning, Joy Brenda Midiwo, advocate, and we have Philip Magala, lawyer. We have Mark Bichachi, communication consultant, and Bashir Suleiman, who is an advocate. Now, let's get to it. The bigger story, the lesser story, but still a big story, is the coronavirus making headlines across the world. You would be at pains not to find it anywhere online or in the dailies, and it's affecting everyone. Started off in China, but now the whole world is feeling the ripple effects. Now, we're told on the top page of the Standard, Kenyans start to feel the corona heat. I don't think we've just started. We've been feeling it for a while, but then they're breaking it down to various sections. Sports, major sports events from football to baseball, athletics and golf cancelled, and uncertainty over Tokyo Olympics. And then we have exports, flowers and vegetable exports collapse, companies running out of basic supplies and raw materials. Then we have aviation, thousands of flights cancelled, risk of job losses as world stares at a total lockdown. Then education, Ministry of Education bans handshakes and hugs in schools. Health Ministry puts the whole country on alert, while the economy obviously is being affected. Businesses struggle to export or import goods. Turnover falls as threat of closure and layoffs loom. I'll start with you, Joy.
I don't agree with you that it is a lesser story. This is definitely the biggest story, because all across the major newsrooms of the world right now, if you put it on, a story about corona is coming up.
Yes.
It's only in Kenya that we seem to...
We have rendered
we are
it
the lesser
story, but it is the big story.
If you ask me, if there is something that threatens the existence of the people that you're governing, really, that's where you should start. And if you have seen even how in other countries, even prominent people have been exposed to this coronavirus, it means we ought to be taking this more seriously. Right now, we are at a place where, if you talk to people in the tourism industry, I was talking to a hotelier, and she was telling me they were expecting by now to be at around 60% occupancy. In terms of bookings, but they're now less than 20, and they're cancelling some more. And she was even telling me, you guys need to pray, because where we've reached, we are starting to lay off staff. People are working half shifts. It's looking really bad. This is a bigger story, because even when you look at, I think it was something going around on social media that was saying Corona has killed 4,000 people. But by the time it's done, it will have made many more people bankrupt than will be dead. So we're talking about the economy, we're talking about businesses, we're talking about jobs, things that we have been trying to fortify. Add that with locusts, us guys have plus locusts on top. Our economy is about to take a big hit. We're looking at food security. So as far as I'm concerned, this is the biggest story that we need to be concentrating on, and not just the wash your hands, we have enough beds, we have enough what. No, the world is in a race to find, for example, a vaccine. Are our researchers in the race for it? Because this is a chance to actually break big in the pharmaceutical market. Are we trying to also develop a homegrown solution for ourselves? Because remember Professor Obed with his omega-3, the thing that was supposed to cure HIV. This is also a chance to put our stamp on the world of medicine. So for me, I'm seeing a missed opportunity, not just to save Kenyans, but also to market Kenya. So I think this is the biggest story that actually everybody should be concentrating on right now.
And we're told Kenyans feel the heat. Of course, this is not just a Kenyan issue, it's everyone that's being affected. And of course, we are having the United States having a European travel ban, or a Europe travel ban rather. And there's so much information out there, but they're focusing also on Isili as traders are hit with that shockwave. We do know that China is the manufacturing hub of the whole world. So obviously, if it's not operating at peak, as you said, when it sneezes, the whole world, or was it Mike who said it? The whole world catches a cold. Philip, what do you make of this?
Of course, we are only beginning to feel the impact of this pandemic, and I think in the next coming months, even years, we are going to be hit by what it portends. We can see the disruptions it's causing throughout the world. We are told Italy, the whole country is on a lockdown. The whole country is on quarantine. And we ought to be learning from what is happening out there. It means the 115 beds in Bagadi are a drop in the ocean. The counties ought to prepare. We ought to prepare all the public institutions.
The borders?
What if it struck today? What would happen to our children in school? Do they have hand sanitizers? I'm glad that you guys have hand sanitizer. You are pioneers in that regard. I'll tell you for sure, I've never worked with a hand sanitizer, but I'm now challenged to have one in my handbag. I was just thinking that...
He has a man bag.
It's called
we work with handbags nowadays, don't we? I mean, I have a laptop, I have two phones, I stand informed. And now I need to carry a sanitizer. It goes without saying that.
And while they're at it, consider that they're running out of stock in the supermarkets.
Here in Kenya?
Yes.
Hand sanitizer
is running out, so you better hurry up.
And Nairobi County is rationing water.
Yes, we're in trouble.
Yeah, that's what I was thinking. I mean, we are telling people they ought to wash hands. So where do our kids wash hands in school? At the colleges. Look at our matatu system. People want to lock all the windows whenever you are traveling in a matatu so that they can feel the warmth. Somebody sneezes behind you. It is high time we prioritize public health as well. Yeah. There was a cartoon going around the other day about coronavirus being a millennial bug, and that its target is not only to cause disruption but also to challenge the public health regulations throughout the world. What are we doing? And like I said last week, it's not enough to give directives. The Ministry of Health, the Minister Education has the power to promulgate regulations on how we should deal with this particular pandemic.
Right.
People coming in through our airports, are they being screened? People checking into hotels, are they providing details of their travels? Schools, we are told, you cannot just say don't hug, don't greet people. Are there laws that we shouldn't, or regulations that we shouldn't greet or hug people? People spreading false rumors on
social media.
Yes, on social media. Do we have laws under which these people can be regulated? We need to stay a step ahead of this. Personally, I'm also getting skeptical on whether or not this thing is already here with us. We need to face it head on. We have to ask the tough questions. Could it be here with us already? Could it be that Kenyans don't seek medical treatment, and that is the reason why we have no confirmed case so far? We've been told, we can see what is happening in the UK. For Arsenal fans, it is said that the coach has a confirmed case of coronavirus. What do you do when, in case, God forbid, it turns out that somebody is infected? We are told we have to go to extreme cases of distancing ourselves from other people. It's gotten to a point where you have to think about that. It's not just about washing your hands. It's not just about covering your face. We are told people have to take extreme measures of isolating themselves from the rest of the population. And in case anybody has symptoms, we know what the symptoms are. Self-isolation. You should undertake self-isolation. And let's not have those instances where we see people who want to infect others so that they don't die alone. I've seen it on social media, and it's really discouraging. Yeah. People coughing deliberately in other people's faces, people spreading their salivas on lips. I hope it is not here with us.
What social media are you on?
I know.
It is there. It is all. I mean, that is the first thing on my handle when I wake up in the morning.
So gross, I know. But why would you do that anyway? So I like that you pointed out the information flow and that this is a time that is fertile for fake news. And there was the Ministry of Health did text. I don't know if you all got that text, and I was hoping that would get regular updates and advice on what to do, talking about how to self-quarantine who are vulnerable. I'm told the elderly are more vulnerable, people with respiratory issues. So I yet to receive any more information aside from the coronavirus as a respiratory disease affecting the world. There is no cases in Kenya. It spreads via cough or sneeze. That's it. I've received 2 messages saying that. I was hoping for more information. Mark?
Let's start here. The amount of information you can send on text is very little. And then 2, you've got to think about how you're going to frame that information. I must agree with you that I think that information is little, but the fact that for the first time the government is doing a PSA, I have to commend them on at least trying. No,
Yeah,
but therefore,
they've
One
tried.
message.
But they've never done that
last
before.
this is Kenya, my friend.
We are never warned of terror attacks or anything. It just happens
Let's
to
be
us.
very clear.
Yeah.
You know, let me tell you, we've got to learn the art of encouraging them to do more right
Why
things.
should we encourage them,
We
though?
should.
That they do
I'll tell
better.
you we should. Because at the end of the day, in this country,
Yeah.
you need to understand that the people who work in civil service get discouraged that's the same way as everyone does. And
Okay.
when they do a good thing, let's encourage them so that they can keep doing it.
Okay.
You understand?
Well
so
done.
Ministry of Health, keep texting people. You know, that thing of washing hands for 60 seconds,
Yeah.
that's actually a very big deal.
It is.
Because the virus somehow has to get near your orifices, your nose, your eyes, and your mouth. And the best way to get there is your hands, right?
Yes.
So that information is important. The other thing they need to tell people is what is the worst case scenario and what do we do? Okay? Do we stay in Nairobi if Corona comes, or do we all scatter to our villages because there's chicken and eggs you can still eat?
Or would
That's
we
my
be
game
spreading
plan,
it?
actually.
But
That's my
would-
game
would
plan.
we
I'm
be
going to
spreading it
Kitale.
to
Yes,
our...
it's a big question. Because
I'm not staying in a mall.
the truth of the matter is, you see, unlike Western countries, we do not have the logistics of maintaining a population of 3-4 million people in Nairobi with food. You know, people think that coronavirus is scary because of the disease. It's also scary because of the logistical nightmare it would be to feed Nairobians and people in Mombasa.
But Mark, you're talking about feeding. Just picture New Year's and Christmas, the bus stops. Won't that just be another way?
But that's what
of,
I mean.
You know, yeah.
That's the bigger question. Can we handle the logistics?
Yeah.
Because do you want in a place like Africa, right? The best way not to spread the virus is to decongest Kibera, decongest Mathare. So do you want these people in Nairobi, or do you want them back Ocha, where there is 2 acres of land between you and your neighbor? Those are the serious questions that we need to answer.
For sure.
We need to start addressing what is the worst case scenario and what do we do. Because if we don't address that thing, the way I'm seeing Kenyans like Magal saying that when someone coughs in the bus, he wants to almost alight the bus. You know, you need to tell people, what do you do? Because what we are seeing now, there's going to be a run to the supermarket, there's going to be a run to the pharmacy, masks are going to run out, and then what? So that's number one. Number two, we need to understand that this is a very equal opportunity disease, because the wife of Justin Trudeau has just been confirmed to have...
Tom Hanks, I think.
Yes,
Even Tom Hanks and his
stuff like
wife.
that.
And
But
Trump
now-
was actually exposed.
Yeah.
It was with someone who has been confirmed. So they're waiting to see if the Donald will also
Yeah.
sneeze.
Yes. Okay, I will not say what I said and
Yeah.
I will. But the truth is that for Kenya and for Africa, this is time for us to relook at our healthcare system. It is time to answer the question that should the president's Big Four agenda of universal healthcare, is it time? Is it time? Because, as Magal correctly put it, Kenyans do not go to hospitals. All right? Let me tell you, even those of us who have insurance cards in our pockets, your first point of call is never the hospital. It's always a pharmacy. You go there and you say, kichwa inauma, nasikia tumbo, then it tells you, iyo inakaa, shika hii.
Yes.
You know, and is it time we revisited that conversation?
Yes.
Is it time the government sat down and reallocated budget and made universal healthcare a reality? Is that something we need to consider? Because I was seeing, I don't know that it's fake news, where it's saying that insurance companies are not going to cover corona.
It's not fake news because it's force majeure. It's an act of God.
It's an act of God.
So it's not covered by
Yes.
insurance.
So imagine
It is a sickness.
yeah, you get COVID-19, you can't go to hospital.
Yeah.
What do you do? what do you do? And that also means if people
What
can't
are
go
you
to
talking
hospital...
about insurance? At
then-
this rate, it should be free, you know,
Yeah,
service.
so if we had-
They've said testing for it is free, but treatment is not.
Yeah.
Because it's once the WHO declared it a pandemic,
Yeah.
it became an act of
act of
God,
God.
and then it
Yes.
fell under the exclusion. So,
So the truth of the matter is, now, if look at the average Kenyan, okay, let's look at the reality of the average Kenyan. What's a casual job, right? Maybe he's even an Uber driver. Let's even give him a better job than a quarry or something. So he's an Uber driver, right? He wakes up, he's got flu-like symptoms, okay? Now, does he go to hospital or does he drive his Uber? All right? Now, by the time he's driven his Uber, that thing stays on glass and steel for 3 days. So even if he gets out of that car on the road for another 3 days means... So we need to be very clear that now is the time to revisit universal health care.
Yeah.
And part of the reason we need to revisit universal health care is we need to revisit, can we do what India did and start making our own medicine so that we can afford this universal health care?
Yes.
That's what needs to happen. Forget these international things that your patent laws and things like that. These are human lives we are talking about. Let's break those patents. Let's make the hospitals. Then we've got 3 lawyers on the panel. We can send them to Geneva to defend what Kenya did.
Yes.
But the
God
truth of the
and
matter
yeah.
is we need to do what is right for this country, and we need to do what is right for Africa. Because, let me give you a prediction. This is just one of many infectious diseases that's going to affect the world moving forward.
Yes.
Because the trend is obvious. And if we don't prepare, we're preparing to fail.
Yeah.
So Africa needs... Listen, India is shutting down exporting its medication. If India shuts down, where
they're
are we going
keeping,
to...
because they're keeping their medicine for their population.
Yes. So the
is
United
massive.
States obviously is not going to help us. China has enough problems of its own. So what are we going to do? We will start going back to Muarobaina. You know, thankfully, I have a tree of Muarobaina. By the way, I'm selling Muarobaina.
I'm still stuck on the fact that people are expected to pay for treatment in the event
Yes,
that there's an
yes.
outbreak, because I don't think the Chinese are charging their people
well, the
that they're
Chinese have deep
treating in
pockets.
hazmat suits. I mean,
Okay, it's not
this is
covered
the-
by insurance,
yeah.
but maybe the government will
Would-
cover it
hopefully
because
they would,
No,
and I
but you see,
feel
for
like
them
they
to
should.
cover it,
What's
that's
the
what I'm
cost of
saying.
not- what's the cost of not covering
the
it?
government, through parliament, has to reallocate budget. You see, it just can't pay from thin air. You know, so you got to reallocate budget. And I'm telling Kenyans,
And right now
this
there's
for
no one
free.
giving you money for COVID
The
because they need it.
logistical weight we will have to carry if COVID-19 comes here is immense. And let's remember, the Israelis are not going to land here and save us the way they did in 1998. The Americans have shut down, the Italians have shut down. My friend, while you are busy demonstrating for who to be respected and you're about to die,
Bashir, what do you make of this one?
I think just to wedge into that debate, the argument on the part of the insurance companies, they're arguing that the policy does not extend to pandemic diseases. That's part of the argument that they have been fronting forward. But I think for me, I totally agree with my colleagues, and I think the rightful way, or what we need to do as Kenyans and as a country, from the onset, we should not have this disease coming to our country.
Yeah.
Every effort should be put in place so as not to have it. In the event we have it, it will spread around like a bullet train. When you see countries like Saudi Arabia imposing certain restrictions on their citizens, telling them not to visit Kenya, I think they regard Kenya as a highly, as a zone that is on a very red alert.
Yes.
So I think this is a season again for Muslims, whereby just prior to Ramadan, we normally have that event called Umrah.
Yeah.
We normally visit Saudi over a very important religious event. Ramadan comes, then post-Ramadan we again do our Hajj pilgrimage. But I think we are at a time whereby the Saudi Arabian government has issued a notice that lists Kenya amongst other countries that it has advised its citizens not to either visit or not to have any citizens from those countries visiting Saudi. This tells us that those countries have assessed our level of maybe contracting this virus, or even, do we even have it that we are not even aware? Is our testing mechanism poor? Are people suffering at the initial stages of having the virus? There are serious questions that those countries may be asking, but I think the most important thing as a country is every effort should be put in place by the government to ensure that we do not have this virus crossing over to our country, even if it is placing restrictions on various flights, not just the ones that are headed to Verona. So
just to interject, yesterday a plane landed from Italy, isn't it?
Allegedly.
Yeah, not. I don't think it's allegedly. That's something we can confirm.
Yeah.
That's the data we can get, isn't it?
But again,
It wasn't clear by yesterday, I think, whether it was just a plane. That's according to our reporter, Rita Tinina.
Yeah.
It wasn't clear whether it just came a plane to take people back to Italy, or it actually brought people from Italy into the country. So I think that's where we were at.
But I think the most important thing is we need clear flow of communication on the part of the government. The government gives us toll-free lines that are not even functional. So you see, this is what is causing panic amongst Kenyans. The rightful way of restoring sanity and calmness on the part of Kenyans is to at all times give them credible information, and on the part of the government to be honest with the citizens.
Okay, now...
But does everyone else here feel that the world should just take a 14-day holiday? Like just the whole world.
There's a lot of people who would be happy to hear
let
that.
Let everyone who's sick heal, you know, and then... No, because the thing is, there's good news to this. And I think people need to understand this. Number one is that once you catch it and you get healed, you are immune. That's good news. So the reinfection rate is almost zero. The second good news is the death rate is very low.
Yeah.
At 2%, it gets a bit higher when you're over 45, 50, 60. But that's the good part.
Yes.
Now, that also means that there is a chance that if we manage it well, and that's why, to his point, it's very important that the countries that have it should keep it, you know, they don't spread it, yeah? And we need to have very strict measurements. And that's what I was saying. The way this is going, another 2-3 weeks of this, then the world will shut down.
Yes,
The world will shut down, and it will be 2 weeks of no flights, no nothing, until the whole thing is done. And that's another thing that Kenyans need to prepare for, because our flowers are going to suffer. Parliamentarians, per diems, internationally.
Benchmarking.
They were told to refund some per diem.
What I hear you to be
You see,
saying
that's
is
what
that...
it's saying. It's in this shockwave. There's no report.
What I hear you to be
fact,
saying is that it should get here already. We all get infected. So
No.
What I'm saying,
We actually have to move on, though, from this one.
because the
There's so many
United
other
States
stories.
is now at 1,200 cases, and at its rate of expansion, it's going to get to Italy levels in a matter of a week.
Yes.
Now, thankfully for them, Trump is in charge, and we know how that will go.
And I think on the parts of the government, what they were doing is, for the US, for instance, the head of state was addressing, that Trump was addressing the citizens, assuring them that this is not such a serious disease, it's not more than the seasonal flu and whatever. He's trying to restore confidence on the part of the people.
But you can see the seriousness. It's the commander-in-chief who's taking charge of the communication.
Yes, then again you realize that part of the research by WHO shows that those people who are between the ages of 15 to 30, their levels of contracting this virus is minimal compared to those at advanced ages of about 60s. The other thing is the recovery percentage so far is between 50 to 60%. These are some of the facts that Kenyans need to be shared with, and this is what will restore confidence in them.
And if you have someone who's more vulnerable, who is sickly and who is elderly, you need to be taking special care of them, because they are more, susceptible to getting the coronavirus as opposed to other people. Now, still on health, the biggest story, our big story this morning was that of blood donations. We're told that 9,000 units of blood have gone bad as patients suffer. This is because Kenya does not have the reagent or the paraphernalia that is needed to conserve the blood before it gets... We're even told that we do not have the machines that are supposed to test to screen for HIV, hepatitis, and syphilis. They're not working, and that's the country we're living in right now. So while we were talking about a shortage of blood donations, it's not a question of Kenyans not being able to donate or not being generous. It's that we have an agency or a service that cannot actually manage the pints of blood or the units that are given out. What do you make of this, Joy?
It's tragic because there's this story about blood going bad on the back of the other story about blood being sold.
Yeah.
Previously there was a story and the admission by the incoming health CS that, you know what, there's actually a cartel that's dealing in selling Kenyan blood. And I had a Facebook status update, and I said, Kenyans is nothing sacrosanct.
Surely.
How do you sell blood? I mean, it's one of those things where when you're giving blood, you're doing it as an act of selfless service to a fellow
You're giving
Kenyan.
of yourself,
Yes,
basically.
it's literally bleeding yourself for somebody
someone
else. And when you see things like this, then the conversation that Mark started comes back to bear. We are talking universal health care. Our neighbors in Rwanda are using drones to deliver blood supplies to remote villages. That healthcare is accessible even in the remotest parts. We are here pontificating about reagents and whether we have fridges to store the blood.
It's disturbing.
I mean, there's a demonstrable lack of seriousness about things that matter to Kenyans. And this morning, I remember when we were still off air, I was throwing the challenge to the media that maybe if we give these politicians a blackout, they'll be forced to go to sit in parliament and discuss some of these things.
Issues that matter.
Because now you'll find the reagents are not available because, or you know, the budget for it has not been availed, or the budget was slashed, or there was approval spending somewhere, or there's some procurement issues.
Somebody had the money.
Somebody is sleeping on the job, and this is Kenyans' lives on the line. If we get to a place as a country, surely, where even when people come out to donate, there is no guarantee. You see, like this, the story that is here. The woman was saying, even if your son donates for your daughter, we have no guarantee that it will get to your daughter because
it has to go through,
You look at it and it makes you wonder. These are such basic things. It's so rudimentary. Kenya is not an least developed country. Angalau we are in the developing category.
Yes.
Surely some of these hurdles we ought to have jumped over. And not just that, the energy that we put in doing these blood drives. I know at our church it's like a quarterly thing. Every 3 months or so they come back, they ask for donations. People give of themselves without thinking. Now, if I thought to myself, I brave to donate, and you guys just go put it on a shelf, it goes bad. Why would they put myself through that next time?
Exactly.
But the bigger question comes to, this is blood that is going bad. Okay, what else are we not storing properly? Are we talking about vaccines or medicines? Are people being given expired medicines? What is the real state of our healthcare? I think we need a proper audit because somebody somewhere has dropped the ball, and we've come to a place where, as a country, we've realized health is actually a factor of production.
For sure.
It's one of the things that helps our economy. So can we go ahead and take it seriously? Because we need it.
And it's so disturbing that you pointed out that people are buying blood. And as you buy that blood, we've just been told that the few machines that are meant to screen the blood are not working. So how sure are you that you're buying blood that can be used, clean blood? You understand? And then we're told if you donated on Valentine's Day, there was a drive. It is disturbing that some of the blood collected during Valentine's Day has not been screened and is now going bad. So imagine that. And people have cancer out here, anemia, sickle cell, and so many diseases. Accidents happened. Maternities are filled with mothers hemorrhaging, needing blood. So this is a real need in society. So to have this be the situation, it does not bode well for the country. Philip?
I used to donate blood as a young person, but I no longer do so. You know, it
Because now you're old.
And too young.
That's
He doesn't want to give us his old age in my blood.
Yes. It gets to a point you wonder, you know, I've drunk so much alcohol, I might just get somebody drunk on the machines at the ICU. But then
They may
I
thank you
think
for it.
I should encourage Kenyans to go out and donate blood.
But then where is
There's
it
a
going?
dire need for it.
It might be going bad.
I've seen several drives where there have been appeals by either friends or friends to friends in need of blood for people to come out and donate blood. It tells you that on our part also as citizens, we might be failing in our civic duty to help others. That said, though, you know, it is worrying that we don't have machines to screen this blood. You can imagine yourself as a patient receiving blood which has not been screened. It means you're put at a peril. This points to incompetence. There is gross incompetence on the part of let me not say all, some of our staff at these medical institutions. And one cause of this might be a mismatch of skills.
Yeah.
We are having very funny characters running the show in these various sectors in this country. The recently appointed CS to the Ministry of Health, he is a good man and he is quite competent, but you can see he's not a doctor. I might take flank for that, but then it's true, he's not a doctor. That is a ministry that should be run by a doctor. If you go to the county levels, who are the people manning, who are the people heading these institutions?
Yeah.
Are they competent enough? And health is a devolved function. So even as we look at the national government, we ought to shed light on the county governments. What are they doing? What is their input? The health sector has been in tatters since it was devolved. Do we need to relook at that even as BBI goes around collecting views from Kenyans? Because really, you know, we cannot have Kisumu County doctors on strike. Tomorrow we have Kilifi County doctors on strike.
Yeah.
It cannot be a perpetual thing. These cause disruptions that are costly in the very costly disruptions that are very costly in the long run. So I think it is a high time we relook at and refocus on our health sector.
For sure. And on page 10 of this, the Daily Nation this morning, the same story is making headlines, but they have a different angle. They say Health CS lays out measures to refill dried up blood banks. Now he says that this week, the Health CS blamed poor transition from the United States President's emergency plan for AIDS relief, PEPFAR, on to national government funding for the current crisis. But we're also told that there was a transition period that Kenya was given that it did not take advantage of. So we are to some extent to blame heavily for that, because they did it in bits. They did not just one day wake up and, you know, remove themselves. Yeah. So as he has said, we are filling the gap as the Kenyan government. As the Kenyan government, we have support from the World Bank, which is trying to help as we transition to a self-funding mechanism. We have to face this issue head on, because we cannot be relying on donors for our blood. We have to fund it as a government and as Kenyans. Now, Kenyans seemingly are doing their part, but then the blood is going bad. That is the problem, I would imagine. So do you think, Mark, that we are throwing words at the problem at this rate?
You know, there are things I read in the paper, and I really do not know what to think, because I wonder whether the people who are doing it think. When you hear a story, blood is going bad. When you hear a story, blood is being sold to Somalia. What am I to think? Genuinely. Because it is inexcusable. No, when I say I don't think enough is being done, it's because right now someone is showering, going to the office, and he works for this organization. That's why I'm saying it's not serious. To be honest with you, we have to now think what is a capital offense in this country. We need to start saying, if you do corruption in NHIF, firing squad. We need to start saying that if you sell blood for sick people in Kenya to Somalia, you should be dead by now. Those are the conversations we need to start having. Because the truth of the matter is this. It's not a question of funding. It is a question of priorities. Because in this country, certain things work very well. One of them is VIP protection. If an MP loses 2 out of his 18 bodyguards, we will not have peace in this country. We will not have peace. I remember the other day when the numbers of personnel given to certain MPs was reduced to normal. They cried as though they're in a gunfight every day. I remember there was a complaint once that a certain prime minister didn't have VIP toilets. And toilets were mobilized. I remember in this country, MPs are arguing today about who is going to speak before who at BBI rallies. Those are the things that have priority in this country. I've never heard MPs saying one day, mshahara imechelewa. It's not a lack of resources, it is not a shift from American funding to IMF funding. It is simply lack of priorities.
Yes.
Because, let me ask the question, honestly. You want to tell me that we raise 1.7 trillion in taxes, but we need foreign funding to take care of blood? We are insane. Because if you're going to build a country, there are things you need to be able to do yourself. Educate your children and keep your people healthy.
Right.
Those are not things we should be borrowing to do. Otherwise, why do we have Nairobi University, Egerton University churning out doctors who know what to do?
Yeah. The situation is right now, we're even losing jobs because
Like I wrote
of the lack
before,
of funding. Yeah.
Kenyans are very serious about jokes. And one of the jokes we are serious about
Yes.
is respecting people. Now you're demonstrating for people to be respected and your blood is rotting. You are seriously sick
Yes.
and not coronavirus.
Yeah, this is a different kind of illness, and we are told that there are only 75 medical laboratory technicians and nurses working in the 6 regional blood service centers in the country. Transfusion services figures indicate that there are only 2 drivers attached to it. 2 drivers. I mean, unfortunately, we've run out of time, so we're going to take a short break. So I won't get your sentiments, Bashir, on this.